Thank you for watching the World Community Magazine's Hour of Power Live on Facebook with your hosts Edward McQueen and April Garner.
Whoa. So are we live? We're live, back on. Right here, WC Magazine Live. Good evening, I'm your host, Ed McQueen, and welcome to our program today. We made some changes, as most of you know, some abrupt changes. And we originally had another gentleman of medical background who was a cardiologist for us, but I'm sure the person that's replacing him, you're going to get just as much information, and it could be just starters. Maybe next week we'll continue on with this. So I'm your host again, and of course, on my left or your right, Sister April Garner Davis, and she is the co-host here to make sure that this thing runs properly and efficiently. So we're happy to have with us a well-known doctor. He's retired, and he's happy to be able to share with us some information that we thought is very timely now because of some some issues that were medical issues that has been going on that we don't think needs to happen. At least I don't think so anyway. And a lot of this stuff is preventive. You agree with that, April?
Absolutely.
Yeah, a lot of this stuff is preventive. So that's what we want to do, provide you with some preventive, quote unquote, medicine, so to speak. So without further ado, let's introduce our guest. To a lot of you, it doesn't need introduction, but local retired.
You starting with him or the Porterfields? Remember we have the Porterfields as well.
I'm sorry. And the Porterfields know I wouldn't want to neglect them. Yeah, I mean, this information is just as good. Okay, so we're going to start with our two reporters for WC Magazine. And you can see on the left there, you know who they are, the twins, the Porterfield twin, and it's called the Porterfield Report. So without further ado, we have with us Desmond and Destiny Porterfield, ready to come with their report and opinions and everything else that they feel needs to be heard. All right, let's go with it. What do you think?
All right. How are y'all today? How are you?
We are good.
Good. All right.
So for the city council meeting on Monday, April 15, 2024, start at 4:00. First thing they did was have a call to order. Second thing was an invocation pledge of allegiance presented from Reverend Cal Randall, First United Methodist. And for the consent agenda, they had an approval of adoption of annual resolutions recognizing April as the National Fair Housing Month. Second approval was an approval of a special event that's happening December 11th on 2024. It's called Under the Lights 5K.
Which they did approve that. They just they're using a different route this time, but they did approve it.
The third approval was of a resolution to acceptance letter of credit for the remaining infrastructure for Kingston Bay Phase 2. The fourth approval was a purchase of replacement vehicles for the fire department. The sixth approval of purchase of vehicles was for the finance department. The last approval was of March 18th, 2024, the council meeting minutes, sorry. And there was really nothing for the public input as while we were there, but they also had something new when we showed up. They had an introduction of new hires for the city of Conway, and I tell you, it was a lot of them.
A lot of new hires.
Yes, sir. For the city of Conway, I can name some for like it was beautification, welding, new police, adding staff to the police department, and some new 2 new firefighters. For the special presentation, they had a presentation of a proclamation declaring as April as Autism Acceptance Month.
Oh, and they also with the autism, they have a rising in dealing with autism. There's higher numbers for autism, and they don't know what's causing it, but they're trying to figure out what's causing it and like how to fix it, if it's being inherited through the genes or anything like that. They had a presentation of Employee of the Month for April 2024, and the Employee of the Month was a lady named Anne.
We
did not get her last name.
No.
Okay.
For the that was your part. Sorry.
No, go ahead.
For the first reading?
Yeah.
Okay. For the first reading of ordinance ZA 2024, I want to say March. Wait, no, that's not March. That's June 6th, to annex approximately 0.34 acres of property located at 5204 Columbia Street. And they are to rezone from the Horry County residential no mobile homes allowed district to the city of Conway low medium density residential district.
Also to touch bases on that, they were trying to figure out if the property was in the city, and we found out that the property is already in the city, so they approved it.
Already in the city?
Yes.
Yes, sir. Sorry. For the considerations.
A consideration that they did was a consideration of approval of a standard 5K run route. They approved, so they were going to change the route for the 5K. Instead of changing the route, they decided to keep the standard route through Laurel Street and Elm Street for the 5K runners. So they approved that route instead.
And they also have some new events coming, which I think we touched bases on, but we still have to get the date and the timing of it. But it's called Lucha. It was a Lucha wrestling. It's going to be a Lucha wrestling event. I think it's going to be held on the. I still have to get that, but when I get to it, I'll make sure to present it to y'all.
With the new Whittemore school, they connected Whittemore to Bethel Road to where they have lights hanging for an intersection, so where people won't be speeding or anything like that, to where to be a safe zone for the kids and the parents that come pick up their kids.
And also to say for our last thing, they got off track, but we're on track in the city council meeting about the gun law and how the 18-year-olds are able to carry weapons. And sitting there thinking about it, as my sister was talking to me about it, I was like confused at the point of why they downgraded the age of having 18-year-olds carry a gun when they literally just turn 18. Like you just get out of high school, and your first thing comes to mind. Oh, I wanna.
Can I stop you? But it's not just 18-year-olds carrying guns. You got it's 16, it's 15, 16, 17, 18. It doesn't matter what age they are. They're going to be carrying a gun if their parents or somebody gives it to them. They don't care what they do with it. They just have a weapon in their hand, so they're just going to go shoot something or do this or do that with it. That's not what a gun is for. A gun isn't to sit here and kill people. A gun is for your safety, not to sit here and go around shooting at people or causing people harm or killing people's family members or none of that. That's not what a gun is for.
Okay. Hey, you might want to look at that again about the 15, 16, and 17. I'm not sure that's
but the gun laws
that came across that way. Maybe your interpretation of it was a little bit off. I don't know. I can't see that it was maybe worded like that, but just go back and review that. Okay. It's
okay. I got you.
Yeah.
Okay.
But they did get off track, and they were talking about the 18-year-olds and how they shouldn't have passed that. So I agree with them on that one.
Yeah, right. Yeah. 18 is a little young, right?
Yeah. And now it just came across my mind about the wrestling event, the Lucha Libre. That's what it's called. And
the what?
The Lucha Libre. So basically, the Lucha Libre it's in Spanish. It means I've heard it. Lucha Libre. It's where it's high flying wrestlers. It's like the WWE. Take WWE and you would take high school wrestling and put that together, but without a ring.
Okay.
So yeah. So I mean, I'm very excited for that. So, and that is all we have for tonight.
Okay. Sounds like a good report to me. What about you, April?
Well, certainly was a lot.
It was a lot. Yeah.
A lot that happened at the city council meeting, and
wish I could have seen the graphics, April. I wish I could have seen the graphics of the 4K run. Maybe you guys will have the picture of it the next time.
Yes, sir.
Okay. Sorry, April.
That's okay. Thank you, Desmond and Destiny, for attending those city council meetings and bringing back the highlights. When is your next city council meeting?
Our next city council meeting should be next week.
Next week?
I think it's
Not
either it's next week.
Okay, and the city council meetings happens on what, Mondays, Tuesday nights, Monday nights?
Mondays at 4.
Mondays at 4 p.m. Okay.
Sorry. My mom just reminded me. It's actually May 6th. Our next council meeting is on May 6th at 4:00.
Okay, Monday, May 6th at 4:00.
Yes, ma'am.
p.m. All right. So we appreciate you taking the time to hurry from school to go to the city council meetings and capture these highlights. I'm going to call you sometime, maybe next week, so that we can talk a little bit about the city council highlights and touch base before the next meeting. And so hopefully you'll have more information about some of the things that you mentioned that you didn't have dates and times for. And you can report whenever you come back again on May 7th. We hope you'll be ready to come on May 7th, but you just confirm with us whenever you want to come back to give the city council highlights, okay? Can you hear me? Hello? I think we've lost their audio or something, Brother Edward.
Yeah.
We're back.
You're back? Okay.
Okay.
Yeah.
All right. Okay. All right. Well, we'll see you with the next city council meeting update. Thank you so much, and hope you have a great weekend.
You're welcome.
You're welcome.
All right.
Thanks.
All right, Brother Edward, the Porterfield report.
Yeah.
Mm-hmm.
Always waiting for that report. People want to know what happened to the city council at council meetings, and they do their best, but they're getting even better, improving each time, right?
Gathering more information. Yes.
Yeah, gathering more information. Yeah.
Mm-hmm.
Okay. So we're ready for some more, really more information this time. That's stroke prevention, how to reduce the risk in youth and seniors. Nope. Well, that's good.
Well, youth and seniors have
Yeah,
strokes.
seniors, right, and seniors have
So I'm
strokes.
sure the information he shares will be relevant for that. So joining us now is Dr. James Adamson to bring us the topic of the evening. How are you doing, Dr. Adamson?
I'm doing fine. I've just embarked on a new career trying to learn how to retire. It's not an easy thing to do, but
Especially after you, how many years were you in medicine?
oh gosh, over 40 years.
Over 40 years. So now you have to do a new thing. You have to learn how to do a new thing, which is just to relax and enjoy life and no patients, no appointments, all that good stuff.
Yeah, just that's not easy.
Man, after 40 years, I'm anxious to see what you got to share with us. Those are stuff I missed. 40 years, a lot of experience there, brother. Yeah, so I don't know if there's any need for Dr. Adamson to introduce themselves to, I guess, maybe some of the people, but if you can do that, Doc.
Okay, I guess I anticipate questions or whatever. I don't know it, but anyway, for those who don't know me, I'm James Adamson. I'm an internal medicine physician, and just to enlighten some people, an internal medicine physician is a doctor who takes care of adults. You can look at it this way. One way to look at it is an internal medicine doctor is to the adult what the pediatrician is to the child. Don't do surgery except for minor surgeries.
Right.
But over the course of a career like mine, where I did general internal medicine, I took care of common medical problems like heart attacks and strokes, kidney disease, hypertension, diabetes, arthritis. These are common ailments. And of course, tonight we're going to look at a little bit, we're going to look at a little information on strokes. I don't want to sound as if I'm talking down to anyone, but I'm going to say this because I think it's good to have a good basis. A stroke, I'm sure most of you have an idea of what a stroke is, but so we'll all be thinking about the same thing. A stroke is an incident that occurs in the body when there's interruption of blood flow to a certain part. And in this instance, the part of the body is the brain. Whenever there is interruption of blood flow to a portion of the brain, we have symptoms that we call a stroke. Could be a headache. It's just a severe headache with no particular reason that we know of at the time. Or it could be weakness of one part or another. Could be blindness, which could be temporary or could be permanent. So just think of a stroke as just being an interruption of blood flow to an organ, and in this case, the organ is the brain. If there's an interruption of blood flow to a portion of the heart, which is the same mechanism, we call it a heart attack. And that causes dysfunction of the heart and a lot of pain. strokes are generally don't produce that much pain, but some can be painful. There are basically two types of strokes that we think of. One is a hemorrhagic stroke, and the other is what we call an ischemic stroke. But think of hemorrhagic stroke as a stroke where there's bleeding, and the bleeding could be directly into the brain or into the surface around the brain, like we call those like hematomas or subdural hematomas, or bleeding directly into the brain. Either one of those could be pretty devastating, but they occur with less frequency than the other type of stroke that we call an ischemic stroke. And that is a stroke where there's not bleeding, but there's occlusion or blocking of a blood vessel that's leading to a part. Say, for instance, a blood vessel that's leading to the part of the brain that functions for your sight. When that blood vessel is occluded, then you're unable to see. Or it may be another blood vessel, major blood vessel, or blood vessel that's serving, let's say, the right portion of the brain. That would then lead to weakness on the right side or on the opposite side. And these are called ischemic strokes, as opposed to the hemorrhagic strokes, where there's bleeding directly into the part. I don't know if questions will be coming or not, but so that's what a stroke is. I guess you'd want to know, well, how can I, as people would say to me, Doc, how can I keep from having a stroke? He said, I just don't want to have a stroke. Give me something else. A heart attack or something, just take me out of here. But I just don't want to have no stroke because strokes could lead to the sort of disabilities that you are totally dependent on someone. And most people do not want that. Unable to walk or unable to swallow, unable to speak, and sometimes unable to comprehend what's being said. Well, how do you prevent a stroke? I don't have any magic for preventing a stroke any more than I have a magic for preventing the other vascular diseases. But we do know that there are certain risk factors that make it more likely to have a stroke. For instance, uncontrolled hypertension is a major risk factor for having a stroke or a heart attack. These are both vascular disease. Smoking is a big risk. Diabetes risk, and then there are other mechanical things, like you may have heard of irregularities of the heart, like atrial fibrillation, where the top part of the heart is just beating away randomly, and the bottom part of the heart is beating with a certain rhythm, and it's just not congruent. So what happens in the top part of the heart, little blood clots develop, and those blood clots can break off and float to the bottom part of the heart, and then it is sent out to the brain and produces what is called an ischemic stroke. That's where the this little piece of clotted material floats to your brain, and all of a sudden, you can't see, or you can't speak, or you can't walk, swallow, or anything. It depends on what part it affects. So how do you prevent these things? Well, don't have any magic again, but if you have high blood pressure, you can certainly reduce your risk of a stroke by seeing about your blood pressure, keeping your blood pressure controlled. Well, what is a good blood pressure? Well, good blood pressure, we think a good blood pressure is one where the top number, it depends on other conditions, but let's assume you have nothing else going on. A good blood pressure is where the top number is about 140 and the bottom number is 90 or less. That is if you have nothing else going on. Now, if you have diabetes, then of course your top number should be around 120 to 125, and your bottom number should be around 80. So a good blood pressure then, somewhere between 125 and 140 over 80 to 90.
So Doc, let me interrupt you. Whatever happened to this standard that they used to have was 127, I think 125 over whatever that number was. But that interest of the top numbers always gotten me. There was just one standard, right? Not with the condition that you just put forth, or if you got diabetes.
Oh, well, yeah. Well,
they raised the bar.
No, we've just learned more through observation. We've just learned, and what we've learned through observation is that people with those kinds of readings tend to have fewer complications than people with different reading. Back in the 50s, before April's time, certainly, and maybe before our time, Ed, back in the 50s, maybe a little bit before our time, but certainly before April's time. We didn't have this much information about treating, or the importance of treating high blood pressure. Back in the 40s and 30s, people with elevated blood pressures, over 200 and really high pressures, used to be bled. FDR is one, for instance. One of our presidents, FDR, was bled to lower his blood pressure. That's just like reducing the volume, and then the blood pressure came down. They didn't really know what they were doing, but they didn't know what else to do. They didn't know to tell him to stop smoking. But these are things that we learn over the years, just through observation. We know now that people do better with a lower blood pressure than with a higher blood pressure. They tend to live longer and have fewer problems. So the National Institutes of Health just sort of, through observation, has come up with this scale of these guidelines that give practicing healthcare providers some guidance to give people. But we used to think that 145 was good until maybe 20, 30 years ago. We started to notice, or even before, they started to notice that 145 in a diabetic is terrible compared to 145 in a person with no other diseases. This diabetic is much more likely to have a stroke or a heart attack or to have kidney damage than the person who doesn't have diabetes or high cholesterol or any of those problems. Now around 120. I mean, a lot of the endocrinologists and neurologists are pushing 120. But in the out in the field, like where I was, I say out in the field, but out in practice in a community, I have to be practical. It's very difficult to get people to take what it is necessary to get their blood pressures down to 120. So we settle for 130, 140, but we keep.
You starve yourself to death not eating anything.
Well, I mean, let's just be, people just, just say, well, I'm not just not going to do that. I feel terrible when people say I feel terrible when I get on all those pills. Um, so anyway, it's a struggle to try to reach that target, but we know that is the target. So if you're diabetic or have high cholesterol or heart disease, kidney, we want your blood pressure. You should strive to get your blood pressure down in the 120s, the top number, and the bottom number, or 80 at the most, 85, and that just reduces the risk. Well, what else can you do to reduce the risk of having a stroke or the likelihood of having a stroke? If you're a diabetic, you should strive to control your blood sugars. And how do you know when your blood sugar is controlled? Well, one of the best guidelines, one of the good monitors we have now is the hemoglobin A1C. So I used to encourage my patients to ask me what their A1C is, or encourage them to know what their A1C is. Some people didn't want to know, but I think you do better with more information.
Yeah,
So
absolutely.
a good A1C is we strive for seven or eight. We used to say 6.5 but 7 is a good number. 8 is a good number. We have through observation, we have learned that 8 is not so much better than 7 that we have to beat a patient to death to try to get down to 7. And in these terms, we still want people to get to 7, but we know that the people that get to 8 will do pretty good. People that get to 7 will do better, but the difference between 7 and 8 is I guess the bang for the buck is not that great. There is reduction in the complications of diabetes when you go from 7 to 8, when you go from 8 to 7 rather with your A1C, but there's also more there's more lowering of your blood sugars, and more people have symptoms of low sugar when we really jump and let's get down to 7. So at the end of my practice, I've been a little more liberal, just being practical. If we could get down to 8, good. And we also have to keep in mind who I'm dealing with. I mean, if you started at 11 or 12, and we get you down to 8, we'll be happy with that, even though we want 7. But if you started at 8, I'm going to be pushing you to get down to 7, because we know 7 is better than 8. So control your blood pressure, controlling your sugar. These help to reduce the risk of having a stroke. Also, you should know what your cholesterol number is. and getting that down to a reasonable range. Also,
So can we go back to the strokes again? I mean, the what about diet?
yeah.
What's the impact?
So controlling your cholesterol, we like to get the cholesterol, total cholesterol, down under 200. The good cholesterol, which is the HDL, we want to get it up to about 40 or higher, and the bad cholesterol under 100. That's the LDL. Now, all of these problems probably can be managed better with the proper diet and a proper diet, just a diet that's not rich in animal fats, and a diet that doesn't have an excessive amount of carbohydrates, because we now know that carbohydrates may be the enemy. Carbohydrates, you know, if you eat a lot of carbohydrates, there is an increased amount of low grade inflammation. And that's, I realize I'm throwing in a new term here, this low grade inflammation in mammals or in the human body. This low grade inflammation is what leads to arthritis. You've probably heard some people say, you know, I cut out sugar and my arthritis is not as bad. The low grade inflammation has been decreased that way. Also, it reduced the what's going on in your blood vessels are inflammatory processes. And that's what's causing the thrombotic strokes, and that's what's causing the heart attack and the kidney disease. So, a good diet, or a diet that doesn't have excessive carbohydrates, doesn't have a lot of animal fats, but has fruits and vegetables, um, and a moderate amount of exercise. One that doesn't contain a lot of added salt, um, which is difficult to get rid of in our community.
That's for sure.
But it's a good thing to do. I mean, um, that's
Now,
about as good as we you can do to prevent a stroke. I mean, if you have a family history of strokes, the likelihood of you having a stroke is greater than if you didn't have a family history of strokes. So if you know your family history, then you would really want to be diligent about modifying those risks that could lead to a stroke. You know, the risk like elevated blood sugar, elevated cholesterol, um, hypertension. Didn't talk about just sitting around. We call it a sedentary lifestyle. But I'm retired now, so I'm trying to avoid that lifestyle. But a sedentary lifestyle is also a risk. So we need to get a little exercise and a little bit of sunshine.
well, see, I've talked with a number of doctors, I guess, in the past that use the word moderation. So as long as you do something in or eat something in moderation, and you're not even supposed to be eating, right? And they come up with this phrase that says, probably including you, Doc, says that as long as you eat it in moderation, then it's okay. You know, for the most part, they're going to say. How do you measure moderation?
Well, it depends on what you're trying to do. I mean, if you have a blood sugar of 120, you should cut back on. You should reduce your carbohydrate intake and increase your exercise. Now, you might say, "Well, I've been eating in moderate. I wasn't eating much of that before." So you were moderate before, but now when you see these numbers, you have to do less than that. Moderation is whatever it takes to change what you're trying to change, or to work on changing what you're trying to change. I mean, I can't put a exact definition to moderation, but if you're drinking a fifth of gin per day, that's too much, you know. Somebody said, well, I cut down, so now I only drink half of that. Well, I mean, I think half of that is still too much every day. But for this person who was drinking, a fifth or more a day, cutting down to half of that is moderation.
Oh, okay.
But I
And-
wouldn't.
and-
But I wouldn't say you should. Actually, no alcohol is as good as having a drink. Actually, it's better than having a drink. No alcohol.
Yeah. If what beer? Now beer is so come in so many different levels of alcohol that, but that's full of what you just called carbohydrates that people should stay away from. Is that correct? I mean,
Yeah, beer has a lot of carbohydrates in it, and alcohol. The alcohol has a lot of calories, but they are these are not good calories. I mean, they have no medicinal value to the human body.
just thirst quenches, okay, right?
Huh?
Just thirst quenches with
Well,
beer.
and beer doesn't quench thirst. I think that's false advertisement, but
Oh, really?
they keep doing it. I mean, water will quench your thirst,
Absolutely.
but beer is like well, it may have some diuretic effect. It may make you pee out more, but people who defend beer say, well, it's not the beer, but it's the volume of the beer.
Yeah. Okay.
I mean, if you drank 16 ounces of beer, you will urinate a lot. But then you haven't quenched your thirst. You just pee it out. What
So,
others?
so Dr. Adamson, you've given us a lot of information past couple of minutes, and there is a question that comes from Priscilla Fuller tonight. In the past, strokes were seen more in elderly people. We're seeing more strokes now in a lot of younger people. What do you think is the rationale for this increase?
Well, we are seeing in younger people now. Some of this could be genetic, but a major risk of stroke in a younger person is drug use. And I'm not saying that all young people who have stroke use drug, but one of the common things I saw in the emergency rooms when many years ago, and recently, a young person coming in with a stroke, terrible headache or stroke or something like that, and they finally admit that they snorted some cocaine or used one of those stimulating drugs like that will send your pressure way up and cause these little, what we call lacuna infarcts, or little strokes. So I think one of the reasons we see a lot of strokes in young people, is because of the epidemic of drugs. Now there are other reasons too. There are strokes that are due to aneurysms. And of course, if you do have an aneurysm and use cocaine, you are more likely to rupture that aneurysm. And you say, well, my stroke was due to the aneurysm. Well, that's true, but you had the aneurysm a long time. And then if you use that if you get that quick burst of that stimulant, I think that could lead to strokes. And these are hemorrhagic too.
Hmm. And I wonder if you've ever heard of or seen any cases of strokes in young athletes. I know that students who are involved in athletics typically have to have a physical before they begin, their sports seasons.
Mhm.
But when you hear about these types of things in young people, you have to wonder if maybe it's a family history of, like you said, high blood pressure. And a physical is one of those things that's kind of like, you set an appointment, you get that physical, and that one day your vitals may be where they need to be. But the bigger picture is that there is something brewing in a young person. And so when they're involved in athletics, these things seem to creep up. You hear about heart attacks on the field, or strokes and things like that. So it could very well be that family history impacts young people as well, and they don't even families don't know that they have these things kind of lurking.
These these genetic anomalies, or
Yeah.
these things that, I mean, you were born with, you just don't know.
Mm-hmm.
And the sports physicals for the athletes are unable to pick up a lot of things like that. I mean, you can hear a heart murmur or an irregular heartbeat, or you can hear something in the neck. But the other things, the other risks, you just have no way of picking them up. Now, they are rare. Just think of the number of athletes we have, and then there are just a few. But when it happens, it's really a big deal.
Mm-hmm.
But I think they are trying to develop better screening now for the athletes than they used to have. I think some places require an EKG. I know when I used to do those athletic physicals for the high school kids and even middle school kids when I was in practice, they didn't require, they just had a form that the kids or their parents would fill out and check things on, and the kid would come and we'd sign off on them. Of course, I guess I'd gotten a little bit contrary there. I wouldn't sign off on a form that the parent hadn't signed.
Mm.
Is there a family history of this?
Mm-hmm. I get it. Mm-hmm.
I just wouldn't. I mean, some of the kids didn't like that because, they could.
They wanted to play sports, man. I mean,
they wanted to play football.
Come hell or high water.
There's nothing wrong with, and they may be right. There is nothing wrong with them, but I didn't have a good way to screen them. I mean, I could listen to them and everything sound okay. And like you said, the blood pressure that day is perfect. But anyway, I think they're doing a better job now, or trying to do a better job at screening these athletes, because, you every now and then you hear of a big name athlete that had an issue. Like a football player's heart stopped on the field after he was hit,
Right.
I mean, you can't predict that is going to happen. But I believe that once it's happened one time to an athlete, it is more likely to happen the second time than it was to happen the first time. So if I were the athlete, I would stop. But hey, they wouldn't listen to me. The guy wants to play football.
So there's another question that's come in, and I want to lead into that. Well, actually, two good questions that have come in, but there's one thing I want to go back to. Brother Edward mentioned diet a little earlier, and one of our viewers says, "What about processed food?" So I'm sure you can speak at length about how, processed food affects things, such as your blood pressure and all of that, and why it's important to stay away from those things as much as possible.
If you can avoid processed foods, by all means, do it. But we've gotten so in this society that it's so hard to avoid them. If you can get your stuff right out of the garden, fresh fruits and vegetables, not or meats that are not processed, they would be much better than the processed ones, because the preservatives used in these processed foods and items usually, or a lot of times, contain sodium and sugar and other things. Fresh is better than processed. But I don't know how to tell you to avoid processed other than just don't buy them. But so then it's the question, well, what am I going to get then? Because they're produced. These things come from places like Florida and California. They have to be packaged in a way that they could survive the trip and all. And some come from South America. So I don't think processed foods are. Well, I know they're not as good as the fresh foods. And if you had a choice, get the fresh foods. Now you can go to the farmers markets and other places, and even the grocery stores, and you could buy fresh vegetables right there. But you have to make several trips. You can't buy stuff for weeks. It only lasts a few days. You just prepare it, and that's what you eat. I don't know how to avoid that.
Yeah. So there are a couple more questions, and one that I would like to add to this. One is, what are the signs of a stroke, that somebody's having a stroke? I think there's an acronym, right? There's an acronym that goes with that.
Well, there are no clear. There are no. A stroke is an event that occurs when the blood flow to a certain part of the brain or neurological symptom or neurological system is compromised. Now, if you suddenly couldn't speak, you know what you want to say, but you can't speak. Well, that's a stroke. If you couldn't raise one part of your body, couldn't use one part of your body, so all of a sudden, so you're sitting and your left side is weak. That is a stroke. Now, whether it's a permanent stroke or just a TI, what we call a transient ischemic attack, or TIA, we'd have to wait and see. But it's just it's a sudden interruption in neurological function. If it's if it goes right to your eye, then you're blind, and that eye, but the other eye is fine. Or if it's to the visual center in the back of your head, that's pretty bad. You just can't see, because this is really in the crucial part of the brain. Or a stroke could just be confusion, just sudden confusion, So suddenly you don't, or the person you're with, or you see somebody, where am I? I don't know where I am. Just all of it. That could be a stroke. So there are no clear symptoms, but weakness is one. Inability to do a certain function that you've taken for granted could be a stroke. And if you do have a new neurological deficit, this is what these would be. If you do have if a person has a new neurological deficit, in other words, something that they've always, or they could do a minute ago, can't do it now, they need to be evaluated. I recommend them going to an emergency room to evaluate a new neurological deficit, even if it got better within 10 minutes or so. Because this could be just a piece of a thrombus just broke off and temporarily occluded a vessel, but the big one is coming if you don't get something done about it.
Mm-hmm. So I was able to find this chart, and I'm going to drop in the comments where you can actually view this particular chart. And just to give credit to the publisher, but all of the things that Dr. Adamson just said are the BFAST acronym that some people know about, and things to look for, especially if you're with someone and maybe you're not having a stroke, but that other person is going through an episode. And here, some things that you can look for in a person. A personal account of mine, a friend of mine was actually going through an episode of having a stroke, and had someone with them. And luckily, the person who was with them was able to identify or recognize that there was something wrong, and that it appeared to be the signs of a stroke. And some of the main things that you talked about, the speech and, just not really being coherent. The face was, I think, droopy, or maybe one side of his mouth, and that kind of thing. And if that person had not acted as quickly as they did, then it really could have caused some extensive damage to, this person that I know. And so one of the questions that comes from Priscilla Fuller as well is, how important is it to get people to the hospital after a stroke? And what is the window of time that medical personnel needs to administer, she says, the shot to reduce the effect of strokes? So can you speak on those two things?
Well, we're talking about like a 4 to 5 hour window. The earlier, the better. Less than 4 hours is better than 5, but after the onset of symptoms. Now, when you get to the emergency room, you should go right as soon as a symptom or suspicion of a symptom is there, and you're not sure, just go get help. You don't have to wait for you to make the diagnosis. But what is all of a sudden there's facial asymmetry, or the person could not raise their eyebrows, for instance, or the forehead is smooth. These are little subtleties that we look for as healthcare providers. But as soon as you notice there is something, try to convince the person to let you take them where they can be evaluated more thoroughly. And if it's done within 4 hours, they may be able to give the person what we call a thrombolytic, or something to bust a clot up. But they take a very careful history in those settings, because remember, we said at first that there are thrombotic strokes, and then there are hemorrhagic strokes. They don't want to be giving this drug to someone who is already bleeding.
Right.
Or they don't want to give it to someone with certain other diseases, certain other illnesses, but they know what they are. They will take a very careful history. They may even do an image, a CT scan. They will do a scan to make sure you're not bleeding into your head, because if they give you this shot, as the person calls it, that could make the bleeding worse. But if you're trying to help someone, the best thing to do, I believe, is when they recognize that an event has occurred. I call them a new neurological event. When an event has occurred, just go get some help, and not wait around till tomorrow, or wait around to see if it gets better, because they may be able to give you something that will prevent it from getting worse. And because a stroke, this is usually, a stroke is really as we think about a stroke, it's not reversible after a certain time. I mean, if you've had the symptoms or the deficiency for 24 hours or more, it's unlikely that you're going to recover to where you were before it ever happened. So the first 24 hours, the old terminology was if the symptoms resolve within 24 hours, we call them a transient ischemic attack, or TIA, still a stroke, but transient. If they last 7 days, we call it a RINE, reversible ischemic neurological deficit. And beyond 7 days, it's just a permanent stroke. But our treatment is much better now. So we know if we can catch them early, a lot of times you can be helped, or the person can be helped in this sense that you may be able to reperfuse. Say, if, for instance, there's a blockage to a part of the brain that serves, let's say, your arm or something like that. But you got there within 4 hours, and they can give you the thrombolytic, and they shoot you with the pill, not the pill, but with the drug that could dissolve that clot and then restore the blood flow to that part that was lost. Now, that is a big difference than just leaving it there where you were permanently permanently weak or confined to a wheelchair. I mean, a lot of people, their biggest fear is having a stroke. I mean, of course, now I've gotten to that age too. Well, I guess there is no that age, as you pointed out earlier.
Right.
Young people have it too, but I've gotten to the age now where it is more of a concern than it was when I was 20 or 15.
Well, it's not as well, as I'm learning, as we get older, it's really harder to combat certain things, challenges. Young people, if you see that there's a history, all you can do is encourage them to eat well, exercise. If they have to be medicated for whatever reason, take their medications. But the older we get, even with those factors involved, it's harder to fight certain health issues. And so, that's why this kind of information is very important, and it's critical for the community to be educated on even what we just showed on that graphic, as far as what to look for when it's happening, and what to do, once it's happened. So, Dr. Adamson, thank you so much for being on the show tonight and for sharing this great information. It's really helpful for the community to understand these factors.
Okay. Well, thank you very much for having me.
I know there's a lot more in the vocabulary of strokes and all that kind of stuff. And I know you probably know a lot more, but in the interest of time, we'll get back on here at another time. Don't worry about that.
Okay. All right.
Yes, well, thank you very much. We really appreciate it. And the audience appreciates it too. They're sending their thanks on a great topic. And again, like Brother Edward said, we'll have you back soon for a part two. for a part two.
All right.
All right.
Thank you for having me. I think I just log out, right?
I got you.
You're still on. We're still looking at you.
You take care of that. Okay.
I'll take care of it. No problem. Carolyn Hickman Williams says, thank you for sharing this information. All right. So, Brother Edward, we had a lot of great information tonight, and I wanted to include some community news before we log off for this evening. And some great things have been happening around the area, and great things are to come. And so I want to start with something that's happening this weekend, as a matter of fact, this Saturday. From 11 to 3 p.m. at the Conway Rec Center on Mill Pond Road. The Academy of Hope is having its spring festival free admission for the kiddos and families, food, raffles, games, music, and more. The tickets are on sale at the various schools. You can also call the Academy of Hope to find out more about this spring festival. But hopefully the weather will be great this Saturday, and the kids and their families can get out and enjoy this wonderful spring festival that's going to be put on by this particular school. So wanted to mention that this evening. Also, I want to...
Does everyone know where the Academy of Hope is located?
I don't know. Do you have that information?
Yeah. Well, no.
If you can put it
down there. Yeah, I thought I saw it down at the bottom. I guess not. But there's a telephone number down there for them to call.
Yeah, there's a phone number on the flyer. Yeah. You can call the Academy of Hope. And I can't see that. Actually, it's rather small on this. If you can.
843-397-5719.
Yes. Okay. So you can call the Academy of Hope. You can also, I'm sure, Google them and find their website if you want more information about the Spring Festival. And they've been sharing information as well across social media. So wanted to share this Academy of Hope Spring Festival this Saturday from 11 to 3 at the Conway Rec Center at 1515 Mill Pond Road. Also want to share some great news regarding one of the supporters of the WCM magazine as well, Reggie Dyson and Rejoice WMIR was actually made it through the first round of the Stella Awards again this year for Small Market Station of the Year. And so voting is happening now, and please support Rejoice for the Stella Awards. You can go to thestellaAwards.com to vote for Rejoice as a Small Market Station of the Year. So congratulations to Reggie Dyson and the folks over there at WMIR. We have some great news about some people who've been elected and also who've won some special awards. Mary Cookie Goins, look at Cookie.
Yeah.
She was recognized as News 13's 2024 Remarkable Woman of the Year for the Grand Strand and PD. And I think she went out to LA to actually accept her award. So we want to congratulate Mary Cookie Goins on a job well done and an award that is much deserved. So congratulations to you, Cookie, and just keep doing big things in Myrtle Beach. And speaking of Myrtle Beach, also there was a recent election held for the Myrtle Beach NAACP. They now have a slate of new officers. And here's a picture of all of the new officers of the Myrtle Beach NAACP. Brother Edward, I can tell you that we'll have more information to come about this particular group, and may even have an appearance on WCM Live so they can talk about the initiatives that they're working on for the NAACP.
We'll get the new president on this. Tiffany.
Yeah, I've been speaking with her, and so she says she's going to make an appearance. And so Tiffany Andrews, who stands in the blue dress, she is the new president of the NAACP. And to her, what will be her left, the woman in the suit with the white. I'm trying to describe people because there's no there are no names attached to this photo, but with the white shell. That is Vivian Lockett, and she is the new first vice president of the Myrtle Beach NAACP. We have Robert Nesbitt, who is standing next to her. He was voted in as well, and he is the second vice president, and standing beside him is Sheila Grissett. She is the new secretary. To the far side of that line in the striped dress is Davina Lloyd. She is the new assistant secretary, and standing behind Davina is Earl Brooks, who is their new treasurer. So congratulations to this group, recently voted in as the Myrtle Beach NAACP officers. And if you want more information about who they are and what they plan to do to support the city of Myrtle Beach and the residents of Myrtle Beach, you can go to the Myrtle Beach NAACP Facebook page for more information and postings on things to come, such as meetings and events and all of that other good stuff. So congratulations to this group. And then also there was a city council election, and Kelly Gerald, who of course is standing here with her mother being sworn in. She was recently elected as the new councilwoman for the city of Loris. So we got a lot of great things going on in Horry County.
Yeah.
This is amazing, absolutely amazing. And I reached out to her as well to see if I can get her to come on and talk about her vision for the city of Loris. And she says, let me settle down a little bit. I'd love to come on. So hopefully in the future, we'll have all of these wonderful people who are looking to do the work and get into the good trouble in Horry County. And Brother Edward, this is what we need to see. We need to see people getting involved, and actually stepping out to assume certain positions that are going to be pivotal if there needs to be change in the area. And so congratulations to the new members of the Myrtle Beach NAACP, the slate of leaders, and then also to Kelly Gerald, our new councilwoman for the city of Loris. And so I just want to share those things tonight. And if you have any news and happenings around the area, please make sure that if you are a member of the network, that you post them to the network. This information was brought to you tonight by the network. All of this great information is posted there, but also you can post it to our World Community Magazine page, or if you are part of my friend list, you can post it so that I can see it. I try to go through the social media as much as possible to pick up good things. I miss a lot, Brother Edward, because there's so much going on, and we, of course, with World Community Magazine, are trying to make sure that we promote things that are beneficial to the community, such as nonprofit efforts and endeavors. And so we just want to share the good news.
Yeah. Did we mention last week or week before about the recent designation of historical plaque on Mr. and Mrs. Moore's house?
Maybe we can do that the next show. Do you have any pictures? Yeah, so we can show some graphics and things like that. Yeah, let's post together some information, and we'll do this again next week. Along with the award that was given in honor of Dr. Peter Kelly. We can show that kind of information because I'm sure a lot of people have missed that. So lots of great things, like I said, happening around Horry County and beyond that we'd love to air for everyone to see.
Next week, we're going to designate that a whole half hour to, because it's a lot of stuff, okay? Some things that we didn't talk about. The recent inauguration of event that was put on by the Whittemore Race Pass Historical Society. They have been doing some fantastic things, I'll tell you. So, and as even as recent as yesterday, I believe.
You want to give it all away, Brother Ed?
Look, it's going to come. I got a whole bunch of stuff.
Yeah,
and some photos to go with it.
That's right. Pull it all together, we'll make it happen. But we just want to thank everyone for tuning in tonight. Thank all of you who watched Dr. Adamson's presentation. And of course, we appreciate your support each and every week. We'll be back again next week. Same time, same back channel, as they say, right here, 7 p.m. You can view this by Facebook or WCMmagazine.net. And of course, our broadcasts are available for replay for an entire week until the next show via YouTube. So thanks, everyone. Thanks, Laquinette. We appreciate your support as always. And I'm not going to get to calling names, Brother Edward, because I'll make somebody mad. I'll leave somebody out by mistake. Yeah. But we just want to thank everyone. And hopefully, we'll be here, God says so, next week, same time. What do you think?
God willing, he'll make it happen.
He'll make it happen. That's right. So everyone continue.
Thanks so much.
Yes. Have a great week.
Thank you for watching the World Community Magazine's Hour of Power Live on Facebook with your host Edward McQueen and April Garner.